In this video we will learn about following things about Parkinson's disease, definition of Parkinson's disease, symptoms of Parkinson's disease, differential diagnosis between Parkinson's disease and drug-induced Parkinsonism, difference between Parkinson's disease and psychosis schizophrenia, classification of anti-Parkinson drugs. Definition of Parkinson's disease: a progressive disease of the nervous system marked by tremor, muscular rigidity, and slow, imprecise movement, chiefly affecting middle-aged and elderly people. It is associated with degeneration of the basal ganglia of the brain and a deficiency of the neurotransmitter dopamine. Early symptoms of Parkinson's disease are fatigue, sleep disorder, loss of smell, poor handwriting, and general slowness. 4 cardinal clinical symptoms: 1 resting tremor, 2 bradykinesis, slow movement, 3 postural instability, 4 rigidity. Rigidity is involuntary increase in muscle tone present throughout the range of movement. Extrapyramidal System, EPS. Types of movement disorders. These are symptoms of extrapyramidal system are: drug-induced Parkinsonism. Akinesia is impairment of the power of voluntary movement. Akathisia is a movement disorder that makes it hard for you to stay still. Tardive dyskinesia is involuntary movements of the face and jaw. Tardive dystonia is a more severe form of tardive dyskinesia in which slower twisting movements of the neck and trunk muscles are prominent. Cause of Parkinson's disease. Parkinson's disease is caused by a loss of nerve cells in the part of the brain called the substantia nigra. Nerve cells in this part of the brain are responsible for producing a chemical called dopamine. In this diagram, in Parkinson's disease substantia nigra diminishes, which result is decreased production of dopamine. Following are the types of dopamine receptors and their effect on movements. D1. This receptor facilitate voluntary movements. D2. This receptor block unwanted movements. D3. This receptor block unwanted movements. D4. This receptor block unwanted movements. D5. This receptor facilitate voluntary movements. Balance in basal ganglia, substantia nigra, responsible for coordinate movements like to walk. For coordinated movement, balance between stimulant acetylcholine and controlling dopamine. Acetylcholine act as start for movement. Dopamine act as stopping the movement. Balance in basal ganglia. Balance between acetylcholine and dopamine result in coordinated movements. Low dopamine or high acetylcholine results in involuntary movements, like tremors, at rest, muscle rigidity, bradykinesia, postural instability. This diagram shows dopamine imbalance exhibited in Parkinson's disease. Solution of Parkinson's disease. 2 methods of Parkinson's treatments: block or decrease the acetylcholine by using anticholinergic, boost the dopamine by using dopaminergic agonist, restore the balance and treat the Parkinson's disease. Drug-induced Parkinsonism. Definition: symptoms start when therapy is started and stops when therapy is discontinued, does not or poorly responds to L-DOPA. Cause: anti-psychotics, anti-emetics, antidepressants, valproic acid, lithium, etc. Diagnosis for Parkinson's disease. No laboratory tests are available to diagnose Parkinson's. Patient responsiveness is key to diagnostic measures, like limb muscles, rigidity, resting tremor, postural instability. Differential diagnosis between Parkinson's disease and drug-induced Parkinsonism. Parkinson's disease, asymmetrical, one side, don't depend on drug agents for start or stop. Patient respond well to L-DOPA. Drug-induced Parkinsonism, bilateral, both sides, starts when causative agent starts, stops when agent is discontinued. Patient don't respond to L-DOPA. Difference between Parkinson's disease and psychosis schizophrenia. Parkinson's disease, basal ganglia BG. BG is located in substantia nigra, responsible for movements. Controlling mediator is dopamine. Low dopamine causes Parkinsonism, psychosis, schizophrenia. Limbic system, LS. LS is located in frontal lobe, responsible for love emotions. Controlling mediator is dopamine. High dopamine causes psychosis. Classification of anti-Parkinson drugs, L-DOPA, COMT inhibitors, TOLCAPONE and ENTACAPONE, MOAB inhibitor, SELEGILINE and RASAGILINE, direct dopamine agonist, BROMOCRIPTINE, PRAMIPEXOLE, and ROPIRINOLE, amantadine, antiviral drug. Drug of choice during mild early stage of Parkinson's disease. Age is not important in mild early stage of disease. Drugs which can be used for mild early stage of disease. Monoamine oxidase beta inhibitors, RASAGILINE, SELEGILINE, dopamine agonists, BROMOCRIPTINE, PRAMIPEXOLE and ROPIRINOLE. Drug of choice during moderate severe stage of Parkinson's disease. Age is important. Drug of choice during moderate severe stage of disease. Age less than 60 years. Drug of choice is dopamine agonists. Age more than 60. Drug of choice is levodopa. Levodopa. L-DOPA is precursor to dopamine. Levodopa and high protein decrease bioavailability. Levodopa and low protein don't affect bioavailability. Most effective medication of Parkinson's disease. Problems when dealing with the levodopa. Peripheral side effects, which can be treated by giving Sinemet or Protopa. Central side effects, for example hallucination, duration on-off, which can be treated by CR medication. Long-term effects cause neurodegeneration. Diet restrictions, avoid vitamin B6 rich food. Peak dose dyskinesia, cause excessive relaxation. COMT inhibitors. COMT inhibitors drugs, TOLCAPONE, ENTACAPONE. Mechanism of action, selective COMT inhibitor, decrease formation of 3-methyl-DOPA, which competes with L-DOPA for active uptake into the CNS. Adverse effects of COMT inhibitors, dyskinesia, psychosis, diarrhea, abdominal pain, brown-orange urination. MAO-B inhibitors, drugs of MAO-B inhibitors, SELEGILINE, RASAGILINE. Mechanism of action, monoamine oxidase type B, MAO-B, is an enzyme in our body that breaks down several chemicals in the brain, including dopamine. By giving a medication that blocks the effect of MAO-B, more dopamine is available to be used by the brain. Adverse effects of MAO-B inhibitors, nausea, headaches, orthostatic hypotension, insomnia, serotonin syndrome. Direct dopaminergic receptor, ergot derivative, bromocriptine, non-ergot derivative, pramipexole, ROPIRINOLE, rotigidine. Direct dopaminergic agonist, drug of choice, Parkinson patient less than 60 years only, because, not converting to free radical, so no neurodegeneration, so protect basal ganglia. Indicating ions for direct dopaminergic agonist, Parkinsonism, restless legs, even at night, treated by pramipexole, hyperprolactinemia, and galactorrhea amenorrhea syndrome, treated by bromocriptine. Adverse effects of direct dopaminergic agonist, somnolence, sleep attacks, orthostatic hypotension, nightmares, hallucinations, pulmonary fibrosis. Amantadine, antiviral drug, used in prophylaxis of influenza. It has weaker side effects than levodopa. Mechanism of action, it increases dopamine release and delays its reuptake. Learn terminologies with MJM.